name's Ben Allen. I'm the sales director here at JFC for the Southeast region.
Hi, my name's Nancy Mlinarik, and I'm the sales director for the Midwest.
Hello, I'm Rob Anderson. I'm the sales director for the West.
And I'm Mike Stotz. I direct marketing here at JFCRx. So welcome to our panel discussion today. I'm joined by three people who have spent their careers working alongside pharmacies and watching the automation industry evolve. With Rob, Nancy, and Ben here, collectively, they have decades of experience that gives them a unique perspective on what pharmacy owners and directors are facing today, where the industry is going, and where technology can make a meaningful difference. So we recently spent the summer at some of the industry's largest and most influential conferences, including RedSail Connect, Cardinal Health RBC, GNP ThoughtSpot, and McKesson ideaShare. So today we're going to talk about what we heard directly from pharmacies and what those conversations tell us about the future. Let's start off with the big picture. What was the main challenge or concern that you heard most often?
Two themes kind of came up most often, I would say, at the shows I attended, and they were around controlling costs and labor, stabilizing labor, and also packaging programs, around starting or how do I take my packaging program to the next level. I think that, you can see folks starting to see packaging programs as more than just a compliance tool and a pathway for growth. A healthy patient is a patient on a packaging program. And what I hear from my customers is it becomes offensive and defensive for the program. Offensive in a way that allows you to go out and find patients that value the organization and ease of use of the packaging, and they're also a higher grossing patient, right? Allows you to cycle their prescriptions monthly. And defensive in the way of you're getting all their prescriptions and your competitors can't get that patient away from you.
We're talking about differentiation, right? Differentiating your business and your model from that of your competitors. And it used to be because there was so much competition that you needed to do that. And now it's a survival tactic. So I think it's something that's always been played. And I think just the reason that you're doing it is different now.
What conversations or trends surprised you? Like something you heard repeatedly, but that wasn't prominent a year ago?
I think the big difference was all the discussion around pharmacies closing. And those discussions went in one of two ways. The first was we saw people lose their businesses, people lose their jobs. The flip side is the patients or customers that used to be going to those pharmacies have now moved on to other pharmacies. So it offered an opportunity for growth in some situations.
Yeah, I agree with that. I think the other big theme that I heard a ton, I mean, AI has entered the chat here, guys. AI is entered all of our lives in all kinds of cracks and crevices. And so the independent pharmacy and pharmacy in general world is not immune to that. I feel like we're kind of at like a great proliferation phase of the AI where we're kind of shoving it into all kinds of areas and seeing what sticks, from data entry and workflow triage to like clinical decision support and even like intelligent pricing strategies and patient engagement, right? I think that as it evolves, we're going to find out what works best. But it's definitely shifting. What I see is it's shifting independent pharmacies from a product dispensing model, which it has always traditionally been, to a clinical service provider model.
I was thinking about this, and when I think about the frail elderly person at home that now has to travel outside of their immediate area to obtain their medications, I see some non-compliance occurring.
Yeah, I would concur with that. I mean, these tools are always have to be two aspects of them, which is something that's going to help your business, as well as something that's going to raise the patient experience or elevate the patient experience.
Technology is a tool. It's not necessarily, to replace the folks you have. I think what it is it helps your good people be better. and helps you serve your patients better.
Are there sometimes aspects where technology is going to play the most good or bring the biggest bang for the buck in terms of staffing shortages, reimbursement pressure, growing workloads?
Automating packaging. If you started your packaging program using like multi-dose blister cards, well, it might get to the point where you have so many patients that you maybe stop talking about it because it's such a burden on your staff, or folks feel overwhelmed with kind of the repetitive manual tasks of filling cards or whatnot. What I've seen automation really do is stabilize production, stabilize labor, make that a fixed cost, and allow you to use your good people to grow that avenue, and do more value-added tasks.
I come from the pharmacy world, about 25 years in long-term care pharmacy, and we were a really early adopter of pouch packaging at that time. And what it allowed us to do is, of course, increase efficiencies, decrease errors, but it allowed us to go after new markets, things like pet meds, things like meds to home, things like employer-financed programs. So it allowed us to grow our business and has been a great tool. The other thing it allowed us to do is enter that short cycle market and be able to schedule deliveries in a way that took us to certain zip codes instead of running all over the place all of the time. It allowed us to create a stable environment in the nursing facilities. If they got a 7-day cycle on Tuesday, it came every Tuesday. They could staff for that. They could plan for that. So there were a ton of advantages, and still are today, of the automation allowing packaging types.
Now, what you're discussing also is anything that changes here when you're talking about technology might cost money, and that it might be counterintuitive, but we heard a lot of discussions about how you have to actually spend money, invest money to save money. And sometimes that requires helping a pharmacy owner change her or his way of thinking about investment as a strategy for controlling costs.
Well, what I've told people is you cannot save your way to profitability, right? You have to invest your way into profitability. And it is very, very easy for a business owner to look at an investment like this as a line item, as an expense item. But really what you're doing is you're investing in the stabilization of your labor costs, right? Labor is the most volatile portion of your operation. It's here one day, it's gone the next, and a very consistent point of conversation when it comes to pharmacy owners is trying to find good people and source good labor. And when you invest in technologies, in particular dispensing automation technologies, you are penciling in a piece of technology that is going to be stable for years to come, even as you scale. If you partner with the right organization and you put the right kind of automation into your facility that allows you to scale, it's really cool to see pharmacy owners build their business and have that aha moment of like, hey, I went from point A to point B, and I didn't have to go find a bunch of people to do it. It was just the same the whole time. So I think it's really about reframing the concept of, instead of it being an expense, and it's an investment in profitability.
Yeah, but I'd like to tag on to that. You said one of the most, if not the most expensive cost center in a pharmacy is going to be people. The other one is drugs. So the other thing that automation allows you to do is have a tighter control on your inventory, get more inventory turns on an ongoing basis, and therefore reduce those costs as well.
Standardizing workflow, standardizing production, that makes life in the pharmacy a lot easier, and it also gives the owner the leverage back, right? Now you have a set amount of production you can do a day, and you're not reliant on who's going to show up that day, or the constant turnover.
Machines do not call in sick. They don't take vacations either.
most people I talk to understand that, automation isn't a luxury anymore. It's an investment in permanently lowering your operational floor.
Let's keep on the theme of that investment and how people view it and measure it. So forever, ROI was the primary measure when evaluating an investment in any technology. How long is it going to take for me to reap the money that I spent back? But we're hearing more and more pharmacies focus on cost to dispense a script as the new decision-making metric. So why is this shift important?
Cost to dispense is, especially in this new environment we're in, is been really something people focus on. But I think even using like NCPA digest numbers and looking at the average patient taking 7 meds or more, which is something that is highly attractive to a packaging program, produces $5,100 a year in gross revenue. If you look at that as net, $1,000 a year. So, it'd take roughly 50 patients on your packaging program to pay for your automation.
So to me, the big shift from an ROI model focusing on labor and moving more to lowering costs of dispense is because we are not in an environment where, and correct me if I'm wrong, people on this panel, I don't know the last time that I sold a piece of automation and they immediately started firing a bunch of people, right? That's not the environment in which we work, right? So an ROI model that means I'm going to eliminate FTEs doesn't exist anymore. We need these people more than anything else, right? So traditionally, and I've been in the automation space the better part of my entire adult life, right? So back in the day, you always worked ROI models about eliminating FTEs, and that's just not the environment that we live in anymore. So, shifting focus on what are the areas of my business that I can control, right? I can't control what the interest rates are that I'm gonna finance this piece of equipment, and I'm not gonna the PBMs are gonna reimburse me. I can't control all of that, but what I can control is what kind of technologies I bring in, how do I stabilize my operational costs. Nancy was talking about drugs and turns on our drugs, and so this becomes a part of the stabilization of your business and the standardization of your business. And again, it's investing in your profitability rather than trying to save your way to it.
I go into pharmacies and never do I ever hear the words, "Oh my gosh, people are lined up at the door waiting to get a job here."
Right.
Right now, pharmacies are struggling to keep staff. They'll leave for a quarter an hour more. So it's extremely challenging. I want to tell a story. I sold a machine about a year ago, and this gentleman was a young pharmacy owner operator, had a young family, and he said, "Hey, look, I'm not really looking to cut any staff here. I would just try to get my hours down to maybe 50 or 60 a week so I can get home and see my family." I did a look behind call about 90 days into his practice, and I said, so are you meeting your goal? Are you down to 50 hours a week? He said, "Not yet, but what I'm not doing is standing in my back room with tweezers in my hands to check my blister cards."
So is cost to dispense truly then the new metric that you're all using actively when you're counseling your customers?
Cost to dispense is certainly part of the equation as well. But also it's about going from like a reactive environment to a proactive environment, right? I know we've said stabilize workflows, stabilize production so much. But what that does is it allows you to start planning for staffing around that. So that all plays into your cost to dispense. Nancy's point about inventory turns and having, tighter control of that all plays into it. All this goes into one pot that helps you do that.
And I think both ROI and cost to dispense are effective tools. However, what we try to do is have a prospective customer take a look at the cost of inactivity. So when you look at cost to dispense with and without technology, it highlights that what am I leaving on the table, and that's important.
Okay.
Yeah, Nancy, you're spot on. It's not the cost of the technology that we should be focusing on. It's the cost of doing nothing. You know,
Yes.
the cost of doing nothing oftentimes is far greater than the cost of implementing, whatever the technology solution is.
Are we finding that the technology can alter cost to dispense, not by pennies, but by dollars?
Absolutely.
I think one metric that we like to share with one of our products, it's a product with vision verification embedded in it. And we see the cost of a pharmacist check time going down by 75%. That's a very, very significant number. In addition to that, in some states, we see where pharmacies are able to go and obtain PV2 exemption. So there's a whole piece of workflow, that's a pharmacist piece of workflow that comes out of their operation. Those are significant dollars.
It's about scalability, right? How can I, implement technology to help my good people do more with less and grow without adding more resources? So I think it's all hand in hand.
We see implementations all the time, and we see the impact on staff. And we see staff stressed. So they bring in this wonderful product, they train, they take time to put in place proper processes. We go back and the staff is so much happier. It's just such a delight to see.
So it's great that that theme of I don't want automation if it means eliminating my staff, that's not the only way that you can go, that there are so many more options where you are keeping your great staff, you're just redeploying them.
100%.
Automation isn't replacing, the pharmacist or the technician. It's protecting the pharmacy and helping that technician and that pharmacist be better.
Yeah, investing in automation in any sort, whether it's dispensing technologies, it's AI-driven tools, whatever the technology is, it's about you're not buying technology, you're buying back time. It's how many people do we talk to and just say, I wish I had a couple extra hours in the day. That's what these tools give you, is it buys back time.
The big takeaway I got here is that pharmacist success is not one size fits all. It's not one magic thing. But what is common is the need to build some smarter, some more sustainable operations that can control your cost, lower your cost to fill, make better usage of your staff's time so that you don't have inactivity time, and giving the pharmacy more back so they can focus on what's important for their business. So they're looking ahead and asking not just how can I dispense faster, but more of how can I build a better pharmacy, which is that a theme that you're all taking away too from these hundreds of conversations we've had this summer.
Absolutely. I think if I was to leave somebody with a takeaway, it's that technology, it's not the giant cost that you think it is. It is an investment in the profitability of your business.
Agreed.
Agreed, 100%.
All right, wise words from some wise people who have been around the block a few times. Thank you, everyone, for joining us. And again, thank you to our panelists for being here today.
Thank you.
Thank you.